I am Victoria Novak, and this will be my first video for spirometry, bedside PFT. So the device that my clinical site uses here is the MedGraphics Luki like this. It uses a USB port to plug into the computer, the laptop that we use for it. And then this is what attaches the mouthpiece and the circuit to the box. So when we do the bedside PFT, of course, we're going to come in, wash our hands. We're going to talk to our patient about what we are going to be doing. Let them know that we're going to be measuring their flows because bedside PFT does not measure volumes. So we're going to do that. We want to make sure that we have our patients informed to the best of our ability about what's going to happen, and then we go ahead and get started. So after we've gone ahead and washed our hands and explained what we're going to do, we need to calibrate the machine. So my clinical site calibrates the machines every time they're used. So here's the kind of big, you can't really see it, but here's the 3-liter syringe that we use. So when you calibrate it, for this particular machine, the computer kind of tells you what to do. So there's a little notch on the side, and you find the notch on this side, and then it gets plugged in like this. And then you go through a series of testing for calibration. And here's kind of the handle side. So it will tell you to withdraw and inject. And it has you do that various times to help calibrate the machine. So once we have the machine calibrated, we need to do some things. So we need to record the temperature inside of the room. We need to record the patient. We need to verify the patient, record their age, their height, their weight, and their race. We also need to ask them a series of questions to make sure that the testing is going to be acceptable. So we need to make sure that there's nothing that's going to cause them to not be able to perform the test. So some of these things can be dental work. I was surprised about the one that talks about eating a heavy meal, but anything that would cause them to not be able to be basically at their baseline. So that's kind of how you start. And once you get all of your questions gone through, that's when we get ready to start the test. So what we need to do is you're going to glove up. And then you're going to attach, so we're going to attach the mouthpiece to the flow sensor. So this is the flow sensor, and it gets attached. That's the mouthpiece, so it gets attached like this, and inside there is a filter, so it will get attached like that. On the top here, you can see that there's the grooves, and that's where we're going to attach. So just like this. So this is how it will be when the patient breathes. It'll be, well, like this is how it will be, or the other way around. And the patient will breathe into the mouthpiece. So it's important that we make sure that our patient knows how we need them to breathe. So we need to tell them that we need them to have the mouthpiece in their mouth with their teeth around the mouthpiece and their lips sealed tightly. We'll instruct them on how to do the different maneuvers for the tests that we're going to do, and we'll use the little nose plugs to to make sure that they're getting all of their air through the mouth and not through the nose. So you want to talk your patient through what you're going to do, and then you'll coach them as they do it. So after you do that, you want to make sure that there's not going to be any leaking, so like I said, all that air goes through. And then you have your patient sit upright with their feet flat on the floor, and you instruct them to have the mouthpiece in the mouth, the teeth, the lips sealed tightly, the nose clip is on, and then you're going to go ahead and start recording the test. So you start with the slow vital capacity. So when you do the slow vital capacity, you make sure they have all of their stuff ready to go, and then you say, okay, I want you to just start breathing normal, and you wait for, my facility says 4 tidal volumes at least. It can be more, but they want at least four tidal volumes. And then you want them to take a deep breath in and completely fill up the lungs. Deep, slow breath, filling those lungs out, and then you want them to blow all their air out. And you want them to keep blowing it out until your screen no longer shows a climbing motion. Once it like tapers off, you know that they've gotten all that air out of their mouth. And then you tell them that they're going to take a deep breath in. So you have your patient all set up, pieces in their mouth, and you're going to say, okay, sit up nice and tall, feet flat on the ground, lips sealed tightly, nose plugs on, and I want you to breathe nice and normal. And you're just good, 4 breaths. Then after they've taken those 4 breaths, you say, okay, I want you to take a deep breath in, as deep as you can, and I want you to breathe in until you can't breathe in anymore. And you breathe in, as much as you can. Okay, now blow out. And keep blowing, keep blowing, keep blowing, keep blowing. You want to blow all your air out. And as soon as I see that start to taper off, I'll tell them, okay, take a deep breath in. So that's how we do the so volume capacity. And you do at least 3. You need them to be within 5% of each other. And then you can move on to your next testing. And so then you've done the slow vital capacity, then you're going to do the forced vital capacity. So again, you have your patient is set up, the nose clips are on, and you tell them what we're doing. So this time I'm going to have you take slow, easy breaths. When I say so, I want you to take a deep, fast breath in, and I want you to blast it out. And so you get your patient set up, and they have their mouthpiece in, and you say, okay, nice, easy breathing. And you continue to have them do that for 4 tidal volumes. And then you say, now fast, deep breath in. And they suck up all their air, and then you want them to blast it out. You want them to push all that air out as fast as they can. And that will also measure our forced expiratory volume in 1 second. So that's important too. And you just kind of keep monitoring your patients. And then if you had, that would be what you would do for the pre. And then you can do post-testing too after a bronchodilator if that's ordered by your patient. So you have to make sure that you give your patient time between the tests. They might need a tissue, they might need a little drink of water, as long as you don't let them have the caffeine. But that's kind of how you would do that bedside spirometry. And you can look back and see if they've had other PFTs so that you can compare your findings, and you can see if their lung process is worsening or improving. So that's video 1.